Hi, my name is Rin Sikban. I am a CPA and a lawyer. So I have my own firm in Nueva Ecija and here in Pampanga. 10 years ago, parang 2014 or 2015 pa, nung nandun pa siya sa kabilang clinic niya sa Pure Gold, malapit sa terminal, parang baka nagpa-facial lang ako. Tapos nakausap ko kasi siya, may problem kasi ako that time sa hyperhidrosis, no? So, I have an excessive sweating sa hands and sa feet. So, kinuha din niya ako nun na i-shoot for the treatment of hyperhidrosis. Nag-botox kami ng kamay tsaka ng paa. So, that was a decade ago. And ever since naman, kasi maalaga kasi talaga si Doktora, sa kanya na ako, alagang Contessa na. So, everything. Kasi lagi tayong puyat, no, sa profession namin as an accountant. Lalo na ngayon, busy season, January to April, filing ng annual taxes and FS. So, parang napansin niya nung minsan na nagkita kami dito, medyo bagsak na daw yung ganito ko. And totoo naman, napapansin ko din yung mata ko kasi parang hindi siya bright. So, sabi niya, nirecommend niya yung treatment na bright eyes. So, testingin natin. So, don't forget to like and subscribe Dr. Contessa's page. Click the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's all welcome back Attorney Rins Hikban.
Good morning. Good morning,
yes,
Doctora.
A wonderful, beautiful day,
10 years
Attorney.
after.
I know, it's been 10 years. Yes. So, noon, ano siya? Estudyante ka ba nun? Or
CPA na, Doc.
CPA na, but right now, lawyer na. Yan, no, di ba? Anong
dekada.
susunod, attorney?
Pag ano muna, magtatrabaho muna
Yan.
tayo, Doktora. Tsaka magpapaganda.
Congratulations.
Magpapaganda.
There you go. Of course, after years of studying, and you're so overworked and so busy as well.
Puyat, Doktora.
I know. And because I saw her last time here in our clinic, I was noticing the under eye. Ayan. The concerns of the under eye.
Kasi laging puyat.
Yeah. So you're beginning to notice like there's a hollowness, a sunken part, we call the tear trough area. And then some are saying it's kind of like pigmented or dark circles. The others nga saying parang panda eye. Ano pa ba yung isa? Hindi yung panda. Yung mga dark circles na tinatawag nila. Basta yun na yun. Dark circles, yan. Those are concerns. And the hollowness, or the others have a so-called kind of like loss of the natural elasticity. So the skin becomes loose, or you'll notice fine lines, fine wrinkles under the eye area. And the others are saying eye bags. Okay?
Yun.
So those are concerns in the under eye area. Because over time, some of our elastin collagen, they get depleted. Some of the extracellular matrix proteins, they get depleted. Hyaluronic, they also get depleted. We have them in the skin. They're naturally present there. But as we age, because of all the pathophysiologic processes happening inside, so they tend to decrease. Plus, the production is also decreased. And of course, our lifestyle, apart from aging, the lifestyle, overworked, over-fatigued. Right now, we're in front of computers. So the wavelengths emitted by these screens from our computer, they go also into our skin. So those kinds of wavelengths there, they have an effect on the skin tissues. And the lack of sleep, there you go. So
Number
incomplete sleeping, and then working too much, overthinking, anxiety as well. They release some stress hormones, and these hormones will go into the skin again and causing all these aging signs on our face. Yan.
So, Doktor, ikaw
Masipag.
hindi ka na-stress? Kasi,
Sinong hindi na-stress? I think, yeah. Well, it's how you respond or react to stressful situations,
kasi
okay?
nga, usong-uso ngayon yung reverse aging, like
I know,
Doktora.
yes.
Reverse aging
Thanks
talaga.
to science, we have the so-called reversal of aging. We have treatments, non-surgical,
Yes.
non-invasive as well, to combat the aging signs. So we're excited to do a treatment for a thorny rinse after how many years? Welcome
1
back.
decade.
So we'll show you when we return. And we're back. So we are with Attorney Rin Sikban, and we're doing a procedure called under-eye rejuvenation. It's your first time, right?
Yes,
To
Dok.
do this. Okay. So no treatment in the past. So today we'll be doing the so-called non-surgical, minimal invasive procedure, and the product that we will be using is the so-called Coshine. Coshine is collagen itself. So we're already injecting the collagen, because collagen is a protein present in your skin, responsible for like structural shape formation or skin elasticity. So they're very significant in our skin layer. Yan. So we will be placing a so-called Coshine. Okay? So I have the product. So this is the one. So it's kind of like a whitish color here. So it's already the so-called type 1 collagen, the mature type of our collagen. So you don't need to wait for collagen to form. Okay? So this will treat under-eye hollowness, or kind of like under-eye laxity, fine lines, wrinkles, even those pigmentation concerns. So our Coshine can help improve those. So it's anti-aging, improves the skin texture and quality. Okay, so we are making our entry point at puncture with our introducer needle here, a tiny prick. I'm using like a gauge 21 of our needle, and I have a gauge 25 cannula here. So this one, our entry. So you can place the collagen filler for under-eye hollowness in the subdermal layer. Or it's also okay to place it submuscularly. That's below your orbicularis oculi. So just gently advance your collagen filler in the tear trough area, and you can inject a tiny aliquot there. So that's one. Then I'll also inject in the middle portion here. So I'm just being gentle since first time ni attorney. So just a tiny aliquot, small amount of this. So it's a type 1 collagen, atelocollagen that they call it. And then we'll place it also on the lateral canthal area. So collagen can also be injected here to restore support. And these types of proteins are responsible for the structural framework of our tissues. So they give that good support, lifting, tightening, firming of our skin. So they will prevent further formation of lines, wrinkles, and prevent also sagginess, droopiness, or our medical term ptosis. So I'm going to advance further. So you can also place some of your product submuscularly below your orbicularis oculi. So here I'm going to reach the so-called medial canthal region. And you can use as much as 0.3 to 0.5 per side depending on the need. Okay. So I'll add another treatment called the scaffold. Scaffold is a type of a PDO thread that we can place in the area under the so-called orbicularis retaining ligament. So I'll make an entry point. Usually the entry point you can measure like 1.5 centimeter lateral to the lateral canthus and 1 to 1.5 centimeter inferior to that, or you can measure the length of your scaffold thread so you can have a guide on where will be your entry point. So I want the scaffold to restore support in the retaining ligament under the eye area. So this will be just the entry point. I will just inject a tiny lidocaine here. Yan. Some sting because lidocaine has a low pH. It is acidic. Then we use that gauge 19. Though we can also use gauge 21. Although your scaffold cannula is gauge 21 also. So I'm just gonna advance it. So this one should be placed on a deeper layer because scaffold is made up of several PDO filaments that are braided or intertwined with each other. I'm just being gentle because I know the sensation here is quite a bit uncomfortable. So I'm just gonna glide gently. So we can just use one scaffold for the under eye here. The goal is to give support to that retaining ligament there. Okay, so we're done with the right side. How was it, attorney?
Oh.
It's okay. Yeah. So we did the right side. Let's proceed to the left area. So we have done under eye treatment using our Coshine and Scaffold. We'll show the result when we return. And we're back. Let's show the result to Attorney Rins. Attorney Rins, so we just
Surprise,
did,
surprise.
Yeah, we just did the procedure called under eye treatment, under eye rejuvenation using our collagen fillers. It's the combined threads plus the collagen filler type 1 filler. So
Umakyat.
under the eye, because there was this hollowness, so we want to fill in that hollow part, specifically the tear trough section, the medial aspect of the under eye. So you inject a filler, so it's gonna lift that skin like that. It's gonna elevate it, okay? And then it's gonna improve the surface area. So you'll have this eyelid and cheek junction smoothen. So before having this procedure, you notice that the rim, orbital rim, it's kind of prominent, and then above that, the under eye area is hollow, or we call it concave. So when you fill in, you inject a material, you're elevating that hollow part, making it even to this junction here, the eyelid and cheek junction. You make it smooth on the surface. Then we also added some PDO threads, polydioxanone threads. The kind of threads we use were those multiple filaments. So in one cannula, they already contain a lot of your PDO strands. So actually the scaffold right now, they were telling us that they contain this kind of triple intertwining or coiling for every single part of that intertwine. It's like they're braided. They still contain a lot of mono threads. They contain 13 mono threads. Multiply that by 3. So that's around 10, 20, 30.
36.
39. 39.
Oh, 39.
Yan. 39 mono threads. And the good thing is they even folded it on each other. Like, it's becoming doubled now. The 39 times 2, that's a lot. Ayun, ilan na yan? 30, 60, 78. Yan. So, 78 strands. That's why we only use one cannula there to restore support on that, the ligament here, the orbital retaining ligament. Because as we age, you know, the ligament tends to go down also. So, you place it under that and restore that kind of lifted ligament. There you go. So, to prevent also the ptosis or the sagginess of the under eye area. So, we just injected it right now. Give time for it to still take effect. So, over time, you will still see more improvements. Because especially the threads, they're stimulating also collagen again, okay? More collagen formed. There's like stages of collagens. And also the types of collagen being produced. There are different types of collagen. Kasi type 1, 2, 3, 4, 5, 6, etc. Okay, so in the skin part, we are starting with the so-called young collagen, the so-called type 3. And then they become like the dense collagen to the type 1. So it's gonna happen in weeks, months. So over time, you will still see improvement. So it's already like what we call regenerative medicine. You just regenerate those fibrous proteins that were degenerated, that were broken down, that were lost. So this is science of aesthetics right now. So we have this restoration. That's why you mentioned a while ago. It's like bringing back or reversing the aging.
Yes.
Reversal of aging. Or the clock of time is reversed. Yan. So, sa halip na patanda, pabata.
Tayo ng pabata.
Anong syndrome yun? We forgot already. There was a movie, si Brad Pitt, right? So, that's the aesthetic science right now. So, it's based on also studies, clinical studies. So, they did some histology reports on this. So, we're using products that were clinically studied as well. And then the collagen substance that we place, they call it atelocollagen, type 1 collagen. It's a natural collagen also. So you just place it in the skin tissues. So you're just bringing back what you usually have there. Now, the earlier you start, the better. Because, you know, collagen is depleted. There's depletion of collagen yearly. They reported 1% each year. And they also reported, like, for example, you're 40-ish na, there could be like a 20% collagen that was depleted. Pag going to 60, baka 50% na yung depleted collagen. So don't wait for a lot of collagen to get depleted. Because, you know, if you have more collagen loss, you need more treatments, right? So the earlier you start, the better. And prevention is better than cure. Plus, you see an instant result actually, eh. We did like the treated part, untreated part. We compared. You already notice like instant elevation of that sunken part, that concave part. Yun, instant. And I could say minimal to no downtime.
Yes.
Yun.
Parang
So,
okay naman na siya.
I don't see her with bruises right now.
Yeah.
She can go back to her work. She can go to the court. and yun. Right?
Yes.
So, thank you so much.
Thank you po.
Yeah. Although during the process, you feel some of, you know, the needles, some of the pricks.
Konti lang
Yeah.
naman.
Minimal and tolerable.
Yes.
So, when we were inserting those fibrous threads, okay, so some, you know, tissue, kind of like you feel some pressure there,
Yes.
or heaviness, or you feel the
Pero
end.
ngayon
Yeah.
wala na, Dok.
Yun. Right now, no pain.
Right after,
Yeah.
wala na.
So during the process lang, syempre parang we're inserting those cannula and those things, right? So you feel some of the pressure inside the tissues eh. Yan.
So, Doktora, yung result niya, months pa din
Because
siya
right now you have
mag-work.
seen result na,
Yes,
right?
meron na agad.
Elevation. And then over time, because of
mag-i-improve pa.
collagenesis, elastogenesis,
Yes.
neovascularization, more improvements pa over
So,
time.
parang hindi ako naka-busy season sa April.
Yes! On time for the tax season as well. Yun. So,
Then,
this is
ang
a good
question-
treatment,
Opo.
right?
Ano to naman, Doc? Gano'n siya katagal? Kailan ko siya kailangan ulitin?
Yeah, usually this kind of procedures after a year you can repeat na. But it will depend on the need. Because some people really have this very unhealthy lifestyle.
Okay.
And some people are really a lot older, of course. The older we are, the more treatments we need. Okay.
Yes.
Some people repeat after a year, some people repeat after 2 years. It will depend.
Okay.
It will depend on the environment, your condition, genetic conditions, etc. Yan. So after this procedure, just do ice compress.
Yes.
Then we check again after a week or 2 weeks. We also do like the symmetry check. There you go.
Okay.
Thank you.
Thank you po.
We will show them some before-after photos.
Yes.
And then after a week, 2 weeks. Okay.
Yes, Doktora.
We'll see you
Thank
again, attorney, ha?
Thank you po.
Meron ka ba social media that they can follow you?
Wala po.
Wala. Very busy. Just go to the office. Yan. Sa
Bawal
kanyang-
kasi, Dok, eh.
Yes,
sa
I
ethical,
understand.
ng
Correct.
CPAs and lawyers, bawal pong mag-market.
Yes, totally understandable. Okay, so if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Margul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our videos on our YouTube channel, Contessa Salvador. I think the old one with you, 10 years ago.
Wala na po
Yan.
yun.
It's still there. Let's check it, okay? So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.